Welcome to the second part of our discussion on preparing for pregnancy. Now, continue from where we stopped. It is also important for the following other reasons that you should get prepared before getting pregnant. It is important also for you to do some essential blood tests, you and your partner, both the man and the woman, before you embark on the pregnancy journey. Some of these important tests include you should be screened for hepatitis B and C. You should be screened for HIV/AIDS. You should know your blood group and genotype. Now, some of these viral diseases that are screened for hepatitis B, C, and HIV can be transmitted to your partner, and they can also be transmitted to your unborn baby. It is important you know before you embark on this journey. When you know your hepatitis B, C, HIV/AIDS status, one, it will be important for both of you to know yourself, you disclose to your partner. And for hepatitis B in particular, the partner that is negative can get immunized so that we won't contract the disease from the partner that is positive. And also in the course of pregnancy, some steps will be taken. For instance, if the woman is HIV positive, she will be placed on some medication to prevent the spread of HIV to the unborn baby. But if the test was not done before pregnancy or early in pregnancy and is not known, the unborn baby will be exposed to an unnecessary risk of getting infected with HIV, and the mother too can come down with complications in the course of the pregnancy. And that is why it is important. This should be done before you embark on pregnancy. Your blood group should be known with certainty. For women that are rhesus negative and their husband are rhesus positive, it is important because in the course of pregnancy, they will need to take a particularly important injection we call Ruga to prevent complications to their subsequent pregnancy that can be leading to recurrent miscarriages and other complications. We'll talk elaborately more on rhesus factor later in some of as our discussions continues in other series. But before pregnancy, know your blood group, know your genotype, know your HIV, hepatitis B, and C status. It will be important to treat you, to treat your baby, and to even advise appropriately to get immunized. Some of my patients that were hepatitis B positive, I was able to counsel their partner, their husband, to get immunized so that they won't get infected in the course, because this disease is sexually transmitted. And there are instances whereby it is the man that is hepatitis B positive. The woman will be counseled before getting pregnant to be immunized so that won't contract the disease from the husband. It is also important for you to go for pre-pregnancy counseling and preparation so that you will know that some interventions that will be done in the course of pregnancy. It will make you to be psychologically prepared and financially prepared. For instance, some women may need to have some intervention by virtue of maybe they be having recurrent miscarriages in the past. They may need to have intervention like what we call cervical sacrilege when they are about 3 months pregnant. It is important they are prepared ahead of this pregnancy so that they will be financially prepared, psychologically prepared for the intervention, and not be coming to them in the course of pregnancy as a surprise. And they won't also continue to have unnecessary and unwarranted complications as a result of not being well informed before the pregnancy is conceived. Thank you, and wait for the third part of this discussion.